Hi, everyone. My name is Bon, and I am the research assistant on Embrace, which is a study to support the well-being of racial and ethnic minority women along Utah's Wasatch Front. Embrace was a community-based participatory research study which asked if integrating culturally relevant modules and support services for women into a mobile health unit will improve outcomes related to maternal mortality and morbidity and diabetes and gestational diabetes among Native Hawaiian and Pacific Islander women, or NHPI women, between the ages of 18 to 44 years old, or the childbearing years who live along Utah's Wasatch Front. And the way that this started was based off of these two health disparities profiles. The Office of Health Equity published in 2021, where health disparities in these two areas and in mental health outcomes were prominent among women of color in Utah, and specifically among NHPI women. So a total of 155 women between the ages of 18 to 44 joined Embrace. 102 identified as NHPI, and the remaining 53 identified as Black or African American, Hispanic or Latina, or refugee or New American. And we had three total groups in the study. So we had the NHPI Ocean group, who received a culturally tailored intervention, and they were randomly assigned upon enrollment. We had the NHPI Mountain group, who received a standard intervention and were randomly assigned as well when they enrolled. And all other women of color were placed into this mountain group as a comparison group. And one thing to note is that the NHPI Mountain group and the All Other Women Mountain group both received the same standard intervention. So Embrace was a collaborative partnership between the Utah Department of Health and Human Services Office of Health Equity, the University of Utah Health's Wellness Bus, and researchers, community experts, and community-based organizations, including Comunidad Materna in Utah, the National Tongan American Society, Project Success Coalition, the Utah Muslim Civic League, and the Utah Pacific Islander Health Coalition. And so here on the slide, you can see a picture of the Wellness Bus who implemented the intervention. And the Wellness Bus offers chronic disease testing and health coaching with registered dietitians, and is located in key neighborhoods along Salt Lake County. And for Embrace, they were actually able to hire an additional registered dietitian and expand their locations to Ogden and Provo. And so here is the lifeblood of the project. Here are the community partners that we partnered with, and they employed community health workers. And the community health workers were truly foundational. They were the pillars of the study. They were the ones who recruited, enrolled, and retained the women in the study, and were able to build strong relationships with them throughout the course of the project. And they made sure that the woman felt seen and heard throughout the study, and really connected with them throughout multiple touch points throughout the project. And so participants followed this timeline, and you can see between the ocean and the mountain groups, the differences between them. So at enrollment, everyone came in, looked at the informed consent, signed it, took the enrollment surveys, and this is when they were also assigned to groups. This is also when they took their baseline biometric screening. Between 0 to 3 months, everyone attended their first individual health coaching session at the Wellness Bus with the registered dietitian. This first one was 60 minutes. And for the Ocean group, their individual health coaching session was culturally tailored. And these individual health coaching sessions really incorporate both nutrition and health and self-care and mental health education together. And so the Ocean group also had their first group health coaching session, which was 90 minutes. And this was led by a community facilitator and created with cultural advisors. And they're deeply rooted in Native Hawaiian Pacific Islander culture, traditions, and the heritage arts. At 3 months, participants attended their 3-month biometric screening, and between 3 to 6 months, participants attended their second individual health coaching session, this time only 30 minutes, and the Ocean group attended their second group health coaching session. At 6 months, the participants attended their 6-month biometric screening and completed their surveys. And after the completion of their 6-month surveys, participants did receive a $150 gift card. And then this is repeated again at 9 months, where participants complete their 9-month biometric screening and their 9-month surveys. And participants who completed both received a $100 gift card upon completion. And so we worked with the Wellness Bus to develop the health coaching curriculums, and our project prompted the Wellness Bus to solidify their curriculum. And then we were really able to adapt it and focus it on women's health and self-care. And so we took this and created this beige health coaching booklet. Which was tailored for the standard intervention. And then after that, we adapted it even further for NHPI women. And this would not have been possible without the registered dietitians and our experience working with NHPI communities. And for the Ocean group, we also had the group health coaching sessions, which I mentioned previously. And these were created for NHPI women to gather together. And they were based off of another project at the Department of Health and Human Services Office of Health Equity, entitled It Takes a Village. And these were built with a cultural advisor and led by a community facilitator, Tima from the Utah Pacific Islander Health Coalition. And both of these wove NHPI culture and the heritage arts and health together. And we were able to hold discussions throughout on mental health and self-care. And so you can see the first one was focused on tapa making and weaving mats, and the second one was focused on lei making or kakala making and mana. So Embrace really focused on mental health and self-care, where the EPDS was used to screen for depression and the GAD was used to screen for anxiety. We also sent participants a self-care text message every 2 weeks after they enrolled into the study, and there were 12 messages total. And after that 12th message, they no longer received any self-care text messages. But here's one that we wanted to share with you all that we would share with the participants. And so here are our preliminary results. So you can see that the average depression score based off of these preliminary results from baseline to 6 months decreased, meaning that participants scored lower on the EPDS for depression. And all of the groups had a lower score. And there was a statistically significant decrease among the NHPI mountain group. For anxiety, the average scores decreased for the NHPI mountain group and actually increased among the other two groups. And finally, participants shared about their experiences with Embrace and shared that they wanted representation and research. They were reminded to prioritize their mental health and self-care. They were empowered in their health and wanted more community interaction and highlighted gaps in the study. And so based off of these preliminary results, you can see that mental health improved across all groups. And this indicates that this could indicate that the inclusion of self-care and mental health education in the individual health coaching sessions may have had an impact on the participants. Participants from the Ocean group also shared the importance of the cultural inclusion in the mental health and self-care. And participants in both of the mountain groups actually wanted more of their cultures included into the study. That was something that they had shared. And while anxiety did increase among the Ocean group and the Women of Color mountain groups, this may have been due to increased education, increasing awareness of anxiety and behaviors related to anxiety. And so with that, I just want to say thank you to everyone involved. We really want to acknowledge all of the work that went into this study, really incorporating the health equity mindset throughout this study. Thank you to all of the partners who we mentioned throughout this presentation, and also to Child and Family Empowerment Services. Thank you to the DHHS Office of Health Equity staff. Thank you to the principal investigators, and finally, to the community health workers and to all of the women who participated in this study. Thanks.